Pastor Matawa, give us the opening prayer. Go ahead.
Eternal God, we thank you for this evening. We thank you for your love and faithfulness. Thank you, Lord, for this meeting that has been put together for our good. We ask, Lord, that you carry us through. Thank you, Lord, for the presenters. We ask, Lord, for your wisdom. All the participants, we ask for King of Glory that at the end we have everything. Lord, we give you praise for the knowledge, the insight you have added to us. In Jesus' name we pray.
Amen. All right. Dr. Gloria, one of our choir members, will be singing a very short song, very brief. It's going to be a solo song. You won't have anybody to back you up, so you can just sit down and sing.
Thank you, sir. Let go. I felt like I just couldn't take this life anymore. My problems held me bound. Depression weighed me down, but God kept me close, so I wouldn't let go. I almost gave up. I was right at the edge of my breaking through, I couldn't see it. The devil really had me, but Jesus came and got me, and He kept me close, yeah, so I wouldn't let go. God's mercy kept me, yeah, so I wouldn't let go. So here today, because God kept me, and I'm alive today, only because of His grace. He kept me, and God kept me, yes He did, and He kept me, yeah, so I wouldn't let go. And so we're here today because God kept us, and we are alive today only because of His grace. He kept me, God kept me, yes He kept me, so I wouldn't let go. God's mercy kept us, that's why we're here today, and we won't let go. God held us by His hand, yeah, so we wouldn't let go. God held us by His grace, so we wouldn't let go. God's mercy kept us, yes, so we wouldn't let go. Hallelujah. Thank you so much.
All right, let's put put our hands together for her. All right. Dr. Chioma, you will be taking the floor now. You need to introduce yourself a little bit to us. And we are yours now.
All right, hello everyone, and good evening. Thanks to Dr. John Olabode and the King's Assembly community for giving me the opportunity to be part of this webinar. So my name is Chioma Achi, and I'm a PhD researcher at the University of Cambridge, UK. I've been asked to do a little presentation on COVID-19 and how all this sits with Africa. Let me just start by emphasizing that I'm not a virologist. I am a scientist and a researcher, and I'll be giving my thoughts on what I think we should know and what we need to do in the face of this pandemic. I must commend King's Assembly for, I've been following all the radio talks and the Facebook conversation and discussions going on so far. And I must commend you for all the work you have been doing in creating the needed awareness at this very critical moment. So I thought I'll just give a little background on the virus that we're currently facing. And since we're dealing with a very general audience, I just thought creating, getting all of us on the same page to understand what we're dealing with might be helpful. Yeah, so talking about COVID-19 and the rest of infections, if someone says, for instance, that the person is sick, it means the person has been sick from a germ or organism. So let's just classify them as germs. So germs make people sick, isn't it? And for the sake of this discussion, I just want to elaborate on what we mean when we say germs make people sick. There are just 4 major categories of germs. We could have the bacteria, the germs that cause typhoid or salmonella belongs here. We have parasites, and that is where malaria belongs. Fungal infections caused by fungus. And we also have viruses, such as those that cause HIV or common cold. You see, these germs are things that we cannot see with our eyes. But because we cannot see them, doesn't mean that they don't exist. We cannot see them, but at least we can feel or see the diseases they cause. Now, the type of germ that we're dealing with here is that which belongs to the group called the viruses. And viruses can cause different types of diseases or sickness based on the parts of the body they find attractive. Some viruses can find it more convenient or comfortable to sit in our stomach, and that's where we might begin to experience problems like stomach pains or diarrhea, such as an example of that kind of virus can be norovirus or rotavirus. We've also heard about other viruses like Ebola virus. I'm sure we've heard that. I know that while I was in Sokoto, we've done talks, and they are still doing more talks about Lassa fever and the likes of it. But then a virus would only stay in a place that has receptors for them. So talking about coronaviruses, they are a family of virus. So if anyone has heard about SARS before now, in 2002, SARS affected 26 countries, affected over 8,000 people. So SARS is a type of coronavirus. You might ask then, why is this coronavirus different since we have heard something about SARS before? We have heard something about common cold, which is also a coronavirus. We have heard something about the Middle East respiratory syndrome. Why is this one different? Why is it different? So early this year, the World Health Organization named this new virus COVID-19. So COVID-19 is actually a type of coronavirus. Yeah. But the funny thing about this COVID-19 is that we don't know so much about it. There's so much we don't know. We are a naive community to it. which means we haven't seen this type of thing before. We haven't experienced this type of problem with this sort of virus before. So there's a lot of ongoing research. Scientists are doing all they can to understand the virus better and to see how it spreads. But then what we know is that this virus has some branches, it has some spikes. It's called corona because it has some crowns. It looks like something that has crowns around it. And the virus will go to where it has receptors for it. And a part of the body where you have receptor for this COVID-19 is on the respiratory tract. So when I say the respiratory tract, that's where it starts from the nose, going down to the pharynx, and then the lungs. So we know that there are receptors for COVID-19 on the along the respiratory tract. We also know that this virus can cause symptoms such as fever. So for you to know if someone has fever or not, when you touch the person's body, obviously you feel the body very hot, and you see that either the chest or part of the body feels very hot, so you know the person has fever. And then it also comes with cough. So if you find a cough that is new and continuous, you find someone that keeps coughing for a lot for more than an hour, then it's a pointer that we need to seek medical attention. One thing we know, even though we don't know so much about the virus, about COVID-19, is that when someone is infected, the situation can degenerate very quickly for those who are especially immunocompromised, and the person can have difficult breathing. And this is where all the talks about having ventilators come into play. Because people who have serious complications from COVID-19 might be unable to breathe on their own. That means they need something that would help them to breathe properly. They need something that would help the oxygen to keep spreading in the body. That is where the ventilators come into play. And one very problematic thing about COVID-19 is that as it affects the lung and oxygen is not able to spread very well around the body, it means some organs of the body might not get enough oxygen that they need. And that's where you might begin to see things like organ failure. The organs pack up and then the person may die. This is actually a very serious situation that should not be taken for granted. We have all been following the news. We have been having sensitization in the church, in the religious body, on the news and everywhere, and that's where we'll be hearing that even developed countries are struggling to have enough ventilators. Here in the UK, for instance, there's still a lot of talk, there's still a lot of discussions going around how to have enough ventilators. So this is why we must take it seriously and not fall sick. We mustn't fall sick at this time, So, and that's one reason that we have been asked to keep away from people, because there's a high probability that an infected person can pass this virus to others who are not infected. So if someone who is infected sneezes, for instance, and those droplets drop on the surface or somewhere where someone can pick it up, if you touch that same surface, you're very likely to pick up the virus. And as you take your hands towards your face or your nose, we have already seen that this virus has predilection for the respiratory tract. That means there are receptors around the nose, down to the pharynx and the lungs. And if you take your hand, if you touch that same hand where you have picked an infected droplet from, and you take it towards your face, there's every possibility that this will go down through your nose and into your lungs and cause infection. Now, one thing we must bear in mind is that this virus does not live independently for a long time. It doesn't live outside the host for a very long time, So it could stay there for around 24 to 72 hours. And that is why it needs us. It needs people to replicate. It needs people to survive. And that is where the whole idea of guidelines of the government saying stay isolated comes into play. So that means the more likely an infected person stays isolated, the less likely the person is to spread the virus. So it is not the virus that finds ways of going on its own. we carry the virus and we spread it. So if we respect isolation, if those who are meant to be under quarantine, stays under quarantine, the virus is very likely, the spread is very likely to reduce. Because we also touch surfaces, we come in contact with things, we touch places that people have touched, we touch objects, we are very likely to pass it on to our faces. That is why we are being encouraged to do a lot of proper hand washing and use of hand sanitizers. Obviously, as we would already know, washing your hands with soap and water is more effective if you can do that. But we also know that there are places you will be going to that you won't have water and soap with you. And that is where the sanitizers come into play. Now, for most infections are for some other viruses. We've heard people saying people who are immunocompromised or people who have other infections. That means people who are sick from other things are more likely to get infected. And if you look at our community, our continent, for instance, and take Nigeria for an instance, the probability of people that have other infections is on the increase. And that means most of us would likely be at risk. One thing we must also remember is that this virus doesn't respect age or race or the color of the skin. We have had reports of people die from this. We've had newborn babies die. We've had 13-year-olds die. We have people in their 20s, people in their 40s, 60s, 80s die. So it can actually affect anyone of any age and from any country. Here we have seen Black people die. We have seen Asians die. We have seen white people die. So this is a virus that can affect anyone, irrespective of their age. And that is why it must be taken very seriously. Again, as we must have heard on the news, we said it's a pandemic. So when you say something is a pandemic, it means something that affects most countries of the world. This morning, when I was thinking about this presentation, I had the chance to look at Johns Hopkins University website. So they sort of provide an up-to-date information and statistics about the virus. And as at 12:32 p.m. today, they stated that the virus had killed 53,975 people. That is almost 54,000 people in 181 countries in the world. We're not talking about 54,000 chickens. We're not talking about 54,000 rats. We're not talking about 54,000 sheep or goats. We are talking here about 54,000 people. So as at this morning, the virus had claimed 54,000 lives in 181 countries of the world. Amongst the confirmed cases, we have 1,026,974 confirmed cases in total all over the world. In Nigeria currently, and as when I checked this morning, we had 184 cases with 2 people that have died from the virus. Now we'll see that 11,000 people, if you follow the news, 11,000 people have died in Spain. 14,000 people have died in Italy alone. 6,000 people have died in the US, and about 3,000 people have died in the UK as at this morning. In Africa, in the whole of Africa as a continent, we have recorded 125 deaths in 47 countries in the region. And these deaths, includes people that are less than 40 years, it includes old people, it includes people that have other underlying health conditions. But as we already know, the common practice in the country is that we tend to underreport things. But let us hope that we are not underreporting in this situation. Even though we have a lot of people who have been dying, I know you would ask me, anyone could ask, are there no recoveries? Yes, there are actually recoveries. A lot of people are recovering from the virus. As at 12:41 this morning, we have 217,000 people that have recovered out of the 1 million people that have tested. So that gives you a difference of about 800,000. So it tells us that there are still a lot of people that are carrying this infection in the community. So if we look at this in two categories, we look at two major groups of people here. We look at those who have been tested and have been confirmed positive. Apart from those that have been tested and confirmed positive, let us also remember that there are those who may have come in contact with infected people but are not showing any signs and have not been tested to be positive and are still going on to spread the virus in communities. So because we have people who haven't shown sign and are still going on, is the more reason why we should be concerned, because these people might still go on to keep spreading the virus to other people in the community. And this is why we need to test. The country needs to test. We have to do more testing and testing to stop the spread. Now, I have heard a lot of things. So we're talking about the Nigerian context and the African situation here. Let me bring it back to home. I've heard people say all manner of things. They said this virus doesn't kill a black man. They've said things like this virus is only something that affects the rich people or that affects the big men and the politicians. Now, let me give us a very little scenario. Let us even assume that in Nigeria or in Africa, the virus affects only rich people. If we think about this scenario, we have had, take for instance, we have this big man or this politician, as we call it, that has visited a country, say an Asian country, say it's gone to China or gone to the US or gone to the UK or to Spain or Italy. And this big man, the so-called big man, lands into Nigeria. If you have been to the airports, you will know what the common practice is. As you get there, they ask, Oga, what do you bring for us now? What do you get for us today? So the rich man or the big man would obviously come in contact with airport staff or staff working at the airports. And recently, they've looked at the infection rate of this virus. So when I talk about infection rates, they're looking at how many people an infected person can spread the virus to. So currently, they are looking at an infected person being able to spread this virus to at least 1 or 2 other persons. So take, for instance, this airport staff picks up the virus from this big man and goes along to interact with his or her colleagues. Let us assume that the staff that came in contact with the big man now spreads this virus to 2 other colleagues in the same office. You might say, this doesn't concern me. Do I work in the airport? Or how do I come into the cycle here? Now, this is where I'm going to. This staff, let's assume that he or she has spread it to 2 staff, right? That's an analogy. And one of them has a private car, for instance, and the other one has to take a public transport back home. Let's assume that another infected person takes the public transport back home. He or she sits with, say, 4 or 5 people, either in the bus or in the taxi, sneezes, coughs around, infects other people. You don't know who is in that bus with him or in that public transport with him. Another person gets infected, and probably the person is just stopping by the market to pick some items. The person picks up that item, you or any one of our loved ones or relatives happen to be in the market at that time, gets in contact with this random stranger that we don't know because we're just passing, who sneezes or who has touched the table, and we pick the droplets from that table. We now pick that virus and come back home. Let us look at the other scenario where this the second staff, who is in his private vehicle, enters into his car, drives into his house. Let us assume he has a gate man that has opened up the gates for him. The gate man opens the gate for Oga. The gate man comes in, helps Oga to open the door. Oga, please let me help you carry your bag or your suitcase. The gate man picks up Oga's suitcase. And let us assume that Oga has sneezed or Oga is even infected already. and has sneezed on that suitcase. The gate man picks it innocently. Oga walks in, hugs his family, comes in contact with them, gives his wife a handshake. Probably the wife gets infected, passes on to the house help, sends the house help to the market, or sends the house help to the market, or the house help gets into the market and then it spreads, or the children of the gatesman ends up playing games with others. And this is how it keeps spreading. So we shouldn't say that this is not a disease for the common man. More than ever before, what this virus has taught us is that we are more connected than we have ever thought. So it is not about just the big men. It is not about the politicians. It is something that affects all of us. Now, as a people, our worry now should be about the truth, about the number of positive cases in Nigeria, for example. We already know how much this test costs. Yesterday, I was listening to the news on TVC, and Achi-Jev said it costs about 10,000 naira to test one person. So you can imagine the cost of testing everybody. How do we actually know the true number of people who are carrying this infection in the community? That means we must all be careful. We must all be vigilant because we don't know how this virus will spread to us. Now, there are some certain things that we must remember and should try to do as Africans. If there is anything we should pick from this discussion this evening, is for us to understand that this virus is majorly spread by human behavior. The virus will not spread on its own. It needs people to carry it around. Except it is very essential. I know we're just seeing the picture in other countries. We haven't really felt it, so we haven't seen the experience yet. But except it is very essential for you to go out, probably to get food or medicines, please stay at home. That is going to be my advice, because right now we're on a lockdown. You can come out of the streets here and you might not see anyone on the street. It is very serious, and it's something we should also take very seriously. Proper hand washing and use of hand sanitizers. As I've already said earlier, it's the WHO advises that you should cough into a tissue or sneeze into a tissue if you have one. And I know our practice back home, we can just cough or sneeze into a tissue and the next thing we dump it on the road or just dump it wherever without dumping it into a closed bin. Let us remember that the wind can also carry this tissue to someone else we don't know, or even to someone we know who is a loved one. Remember what they say about try not to throw stones when you live in glass houses, because when you throw that tissue away, you don't know who is going to get to. And if it's infected, we don't know the number of people that it could get to. And they've also advocated that if you don't have a tissue to cough into, that you should just cough into your elbow, which has been advised seriously, and that is what we should follow. Stay safe distances from others. These are the guidelines we have heard where possible. I understand that this might be very difficult for people that might be sharing a small space or a small room, but at least limiting the number of people we come in contact with out there would be very helpful. Bringing it down again to the African situation and back home, we as Africans, we as Nigerians, we have so much superstitious beliefs. We like to deny things a lot. We like to get to the point where this does not exist. It's not true. But you know what? Superstitious beliefs would not take the virus away. Living in denial would not take the virus away. The virus is here. And all we can do is to follow the guidelines and to also pray that we'll all be exempted from this pestilence. We know it's a pestilence and we won't be exempt from it. We must also be patriotic. It's not time to only think about what the government is going to do for us as a people, but it's also time for us to begin to reflect on what we can do to keep ourselves and others safe. It is only someone who is alive that can go out to hustle. And hopefully this will be over soon and we can all go about our various businesses as usual. One other thing we can do, if possible, is that if you have the skills and they've called for volunteer, if it's something you can do to help the country, and you have the skills to do so, please do, and share information as much as possible. So when I saw the link for, I was speaking to Dr. John Olabode, and he said we needed to discuss this in line with seeing how we can prioritize solutions for African leaders and African governments and what we can do as a people. I thought that we really need to ask ourselves as African leaders, the government really need to ask ourselves, and we also need to ask ourselves if we are truly, truly prepared for this pandemic going forward. And if we're in a position to face this, if anything crops up in the future. Now, I've seen a lot of African leaders and governments trying to enact policies that the Western countries are doing. They've tried to follow hook, line, and sinker, what Europe is doing, what America is doing, and the rest of it. But as a government, as a continent, we must begin to understand our own local problems. And we must look for ways to solve our local problems. Our problems are peculiar to us. And it's not time to adapt to just borrow hook, line, and sinker, the strategies that Western countries or developed countries have used. People are saying, try to say, the Western countries will advocate only 2 people should be in a place at a time, except it's a household. But if you look at our African setting, our African scenario, how many people do we even have in a family sometimes? Up to 6. You have people who are sharing the same roof. You can have up to 6 people sometimes sharing the same roof. Our leaders need to think up ways that we can apply. It's not just about copying the strategies. Some of the strategies are good and we can employ them. But then we need to think up our own strategies. Above all, I would say that we need leaders that can be committed, that can show great commitment to this fight. As we have already heard, we have not seen anything. Our generation has never seen anything like this before. And that is why they have said it is an unprecedented time. And because we haven't seen anything like this before, it means that we have to act the way we usually do not act. We cannot use the business as usual approach to make a difference. It will not change anything. Obviously, I would say social distances is important, keeping distance from people and the rest of it, But how do we ensure that when the government is saying keep social distance, how do we ensure that those who are most vulnerable do not continue to suffer? We have a lot of poor people in our midst. How do we ensure that they don't continue to suffer? We must remember that the curve, when they look at the number of cases that are increasing and the way it's decreasing, we must remember that the curve is not going to be the same for all countries. Things have to change. So what can the government do to help the situation? First of all, understanding that Nigeria and most African countries have a largely low-income population or low-class population. It is not enough to ask people to stay at home when they do not have food to eat. That is my take. You can say all you want, people stay at home, don't come out. But people will tell you, some parents will be rather concerned. How do you expect me to stay at home and allow my children to die of hunger? It is not time, are there governments, to ask people to stay at home if they don't have food. It is time for our African leaders to begin to show honesty, at least for this period. I've been following the news and I've been seeing the billions of naira that have been donated as relief funds to state governments. It is not enough. If we must tell ourselves the truth, it is not enough to just collect those billions of donations and billions of money and stash them up for personal gains. This is also not a time for governments or leaders to buy maybe a few bags of rice and tomatoes, bring them into the open field, and get people to start rushing over it and falling over themselves to get a cup of rice or a cup of gari to feed their families. If we must be honest, this is not the time for it at all. Someone said something on Twitter that I was following recently. If we want to do something as a country and we are honest about it, and we have leaders who are committed and are honest to do that, we would achieve it. So take, for instance, if I ask how many of us How many of us have seen NEPA in our house in the past 6 months? All of us. If NEPA hasn't come to collect bill, they would have probably come to cut lights, isn't it? To take off the electricity wire, the electrical wires from our homes. If we are sincere as a government, why can't we, for instance, attach a health team to this PHCN staff or NEPA staff and ask them to distribute this food to households who are poor or vulnerable? They know the address, they know the location of every poor people in the country. They know where the poor people live. They know where people live. So if our government is really sincere in providing relief materials, there are better ways to do it, you know, and it's not about going into the open fields and making people fight over things. After all, we're talking about reducing the spread of the virus. They must also be concerned, and they must also note that by bringing a lot of people into the same place to share those little available food, they are also helping to spread the virus. And that is one thing they must take into cognizance. So this is really doable. If we think about those in IDP camps and what the government can do to provide help for them, if they don't have water, please, the government should try to provide water for them. Look at the situation in Spain. I'm telling us this not to scare us. Spain and Italy, for instance, the hospitals are now full. They don't have hospital beds for people who are sick from COVID-19 anymore. And what are they doing? They are going ahead to make makeshift hospital beds in car parks and in the field. The graves are already too full. They have called up the army to set up emergency burial grounds and emergency crematorium to take up the number of people who are dying. I must commend the NCDC for their leadership and COVID-19. They've been doing a lot of work about it. But then the government has to help to provide the resources to do more testing. It is also time for our African leaders to think about our healthcare system. Now, as I said before, we've now realized that nobody can run away. The borders have all been closed. It is not time where someone will get sick and they will run to an European countries or the Americans. No, this is time for us to face our problem. It's a time for our leaders to now reflect that this healthcare system they have failed to fix would consume us all if nothing is done about it. It's not time for leaders or ministers to say the doctors can go. We have enough doctors. If you want to go, you should go. It is not time for that. Look at what the US have done. In the midst of all this crisis, they started calling for healthcare workers and professionals. They're like, those that want to help them can come up and start helping them. They can get their visa. It is time. Nigerian doctors are the best anywhere in the world. If you go to any country, you must see a Nigerian doctor and they'll be doing well, you know. So I think it's time for the government to look into more public-private partnership. If, for instance, they can tell the billionaires, look at the hospitals in the various regions, for instance, and tell the billionaires, we give you this hospital, bring it up to state-of-the-art facility. I'm sure that would go a long way. The government also have to pump a lot into research. We are using the data from other countries that are doing research. But what about our own local research? It is time to encourage more local content, encourage innovators. The borders have been shut, so that means a lot of countries are seeking to use their protective equipment, their own ventilators. They don't want to sell it out anymore. How can we begin to think inward? What can we do? We need to prioritize the amount of money we send into the healthcare system, the amount of money we put into science, the amount of money we put into research, the amount of money we put into technology. I just have a very limited time, but I think to round up, even though I still have a lot of things to say, but to round up, I need us to understand that more than ever before, we should know that we are more connected. And the measure of success we'll be getting on this will depend on a number of things. It will depend on how much we have been able to show patriotism, to show respect for authorities. It will depend on how much leadership we can get from our leaders and our government. And it will also depend on how much we're able to utilize the available technology we have, you know, in order to detect the spread of infection, fast-track cure, get vaccine, and how much the government can begin to go into talks with other countries. You know, they're already doing clinical trials for some vaccines already. How would our government ensure that when those vaccines are ready, Africa or Nigeria will be able to benefit from it? if he doesn't support his own research. So thank you very much. I hope I get the opportunity to get more questions.
All right. Dr. Chioma, thank you so much. That was great. We'll still come back to you after. We want to try and bring in the Apostle of Zion, Dr. Martins, to do his own presentation. Mute. Mute. Can we go to discussion? Please, if you have questions, you can start writing them down. Where is Pastor Chioma? Please sing a song and interlude where Apostle connects. Please.
can feel a raging tempest, only you can steal. There is a longing, only you can feel. A raging tempest, only you can steal. There is a longing, only you can feel. A raging tempest, only you can steal. Sunrise to sunrise, I will seek your face. Drawn by the Spirit to the promise of your grace. Take me deeper, deeper in love with you. Jesus, hold me close in your embrace. Take me deeper, deeper than I've ever been before. I just want to love you more and more. How I long, yeah, to be deeper in love. Oh, how I long to be deeper in love. Oh, how I long to be deeper in love. You are great. You are great. You are great. Oh, you are great. You are great. You are great. Everything written about you is great. Everything written about you is great. Everything written about you is great. Oh, 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 oh. Everything written about you is great.
All right. Thank you very much, Pastor Chima. While we're waiting for Dr. Martins, we want to take one or two questions, whether from the attendees, questions or comments for Dr. Chioma's presentation or any other comment. So, what you do if you are attending online, there is a place where you just raise your hand a bit, and then we are going to turn the microphone or even the video to you so that you can say one or two things. So we have just one question now. Okay, there's a question here. I don't know, Dr. Chioma, if you can read the question yourself, or you want me to read it out.
I can't see the question.
Okay, let me read it out. My question is, how far is the search for possible vaccine in your region? There's somebody asking a question. What is the possibility of finding a vaccine for COVID-19, maybe outside Nigeria, since he's talking about in your region? All right, thank you.
Thanks for that question. Just to say that the search for vaccine is currently ongoing, and a lot of countries are doing what they can to ensure that they get a vaccine as soon as possible. Universities and research institutions are already working on it, and very soon, like in few months, we should be able to start clinical trials for the first COVID-19 vaccines. Yeah, so a lot of research institutions are already working on it, and hopefully sooner than we expect, there should be something. Vaccine development would ordinarily take between over a year to 18 months or to 2 years sometimes. But because of the rate at which this virus has been killing, there's been a lot of speed with trials and trying to get vaccine candidates. So hopefully, in the next few months, they should begin to try the vaccines that are already on the study. Yeah.
All right. I don't know if there's anybody that has a question. All right. We're going to take some live questions from our own audience. What they're going to do if you're asking a question is you have to come here. I think if you stand, she can see you and ask your question. All right. Just tell us your name and maybe what you do, and then you can go ahead with your question. So we're taking questions from live audience. All right. Please come. Please start. Come closer and then ask your question. Your name and then ask your question.
Good evening.
Hello.
Okay.
Yeah.
Yes, I really want to know if COVID-19 is airborne or what, because there's a little contradiction here. Some people say it's airborne, some say it's droplets. So we need the clarification. Thank you.
Yeah. Okay. Thanks. Good to see you. Yeah. So there's still a lot of like I said when I started, there's so much that we do not know about this virus, despite the amount of research that is still going on. There's so much that we don't know, and a lot of things is still under speculation. So very recently, the WHO was saying it could be airborne, but obviously for any hypothesis, for any guess to be taken seriously, we need scientific backing for it. Yeah. So, and I think the reason why people think it's airborne is when they compare it to the other virus that is in this family of coronavirus, that's SARS, and they saw that SARS could also be airborne. And the hypothesis is if SARS, which belongs to the same family, could also be airborne, then there's every likelihood that members of this family can also be spread by airborne. But what I would say, whether it is airborne or whether it is via droplets by touching surfaces, the most important thing is for everyone to be able to stay as protected and safe as they can. And this issue of airborne, yesterday I was looking at a documentary on Sky News, and they were looking at countries that were using masks, the nose mask frequently. If you look at countries in the Asian countries like Korea and Japan, China, and they saw that the rate of transmission in countries, say for instance, Korea, was lower compared to others because they constantly use the mask. So, but what I would advocate is whether it is airborne, we know that the virus can pass into our system, into our bodies if we give it the opportunity, is to, as much as possible, stay safe. Now, masks are a high priority, so they're keeping it for healthcare workers and people who are infected. What I would say to people who might be showing symptoms are infected is if you're infected, in order to stop the spread from going to others, use a mask when necessary, because there is no strong scientific evidence to say that it's not been passed via the air or airborne. Yeah.
All right. Any other question? Come forward. Your name?
My name is Nathaniel Shaibu. My name is Nathaniel Shaibu. My question is this: how true is this assertion that coronavirus is a creation of, a conspiracy? Theory, a conspiracy theory. What I mean in essence is there is this belief and this rumor going on that the coronavirus was created by the Chinese scientists to just overtake the world, the superpowers of the world. How true is that? Some argue that the reason why they say that is that Beijing, which happens to be the capital of China, I mean, did not record a single case of this coronavirus. Please, I want to confirm on that.
Okay, yeah, thanks. And just as you have heard the conspiracy theories, I have also heard a lot of the conspiracy theories. I know that whatever the case, if you look at it from any angle, China is already #1 superpower anyway, whether we like it or not. It's gone ahead of the US in terms of science and technology and many other countries. If you ask yourself, why would China want to kill its own people so that it can become the world superpower? Yeah, I've seen conspiracy theories that have said that China engineered it in the lab because they already have a vaccine, so they can save people. I've seen theories that say, okay, it was the US that engineered this virus in the lab so that they can reduce the world population and be able to manage it. And a lot of all of this. I've seen theories that talk about the 5G network being the source of this transmission. I know that viruses can be engineered in the lab, but then I do not have any evidence, any strong evidence to say this virus was biologically engineered or genetically engineered in the lab. What I would say is that for sure, the truth in science does not hide for too long. There is no way you can hide the truth when it comes to science for a very long time. If it was actually genetically engineered or bioengineered in the lab, before you know it, the truth will be out. So I would say for all the conspiracy theories, all we have to do is just wait, and time would reveal the truth if it's actually China or any other country that has gone ahead to do this. But obviously, they would not kill their own people just to be superpowers because they already won anyway. That's really my take on it.
All right, thank you very much, Dr. Chioma. There is a question on the screen from one Paul. This question reads, Africans, especially Nigerians, are known for herbal medication. Are there chances we as a nation can harness this in combating this pandemic? That's herbal medicine.
Yeah, thanks. I think that's a very strong question. If you look at it, most of modern day medicines have actually come from nature. A lot of them have come from plants. A lot of them have been synthesized, and Africa in itself is blessed with a lot of herbs that have shown cure for various ailments. I remember growing up in the village, for instance, and maybe if I get stomach problem, my grandma would just pluck a leaf, grind it, and give it to me, and I get well. Yes, we could have all of these herbal medicines. We could have all of these herbs or leaves that are showing cure, but nobody would believe us if we do not prove it scientifically. Nobody will believe us if we do not do something about it. There are a lot of natural remedies that are herbal. There are a lot of traditional medicines, ethno medicines that are herbal. But then that is why we have to begin to look inward. How can we support our own local content? How can we support our own scientists to do more research in the African continent? We cannot take, like I said, it's not all about the Western countries giving us what we want. We have nature. We have a lot of things at our disposal. All we need is the government to pump a lot of money into science and research, and some of this could come into play. Penicillin, for instance, was developed from a mold, and no one ever knew that penicillin was going to be developed from a mold if the research wasn't done. So I would not say no. There's a lot of potentials with our herbs. There's a lot of natural remedies that we can get from the plants we have around us. But then we would not know, and no one will believe us if we don't do something about it, if we don't carry out science and research to look at their properties and what they can do.
Yeah. All right, Dr. Chioma, thank you very much. Do we have questions? More questions from the live audience? All right, come. Tell us your name and then quickly, one fast. We don't have enough time.
From record, we've been told
Your
that
name.
Olagunju Victoria. From record, we've been told that there were viruses that have actually killed people in massive, like greater than the numbers we're having now. But the news of its spread, is not as much as the way we hear of coronavirus now. So I want to know the difference between the spread of those viruses. Like, is there something different attached to the spread of this coronavirus that has made it gone viral, like the news? That's the question.
Okay, yeah, thank you very much. I think if you look at viruses that have claimed lives this much, some of them did not happen during our time, like the Spanish flu and the rest of it. Some of them did not actually happen during our own time, and probably that is why we didn't hear so much about it. The other issue, what I might be thinking is probably looking at Ebola that claimed a lot of lives, but then it wasn't a pandemic. The reason it did not go very viral like this is going is because it was limited to certain continents or certain countries. And that was why the information did not spread as much as we wanted it to. But in our lifetime, in this generation, since the 1920s, we haven't seen anything this much. And that is why it is really important. What makes this one worse is the spread from person to person. That you can just, other viruses, probably you really have to be in the same place with the person. This one, by just shaking hands with someone, you can get it. And I think that's what makes it such a huge problem. That's what makes it really problematic. I would also think in line, some people might be asking, we've had Lassa fever. Why isn't it making a lot of noise, making the news as much as COVID-19? And that is where we must learn as a people to tell our own stories and to look for our own solutions. We really need to learn to reflect to, if this is bothering us. I saw Sister Yemisi over there. This is where our own people, our own media needs to carry out the news and let the world know about our problems if we want them to come to it as well. But so, yeah, COVID-19, I think, deserves all the attention it is getting because it is a new type of virus and we haven't seen anything of this type before. So it does deserve the sort of attention it's getting now. So I can actually see a few people raising their hands on the platform here. I think Barrister Shade and Edison, Bra Edison. Okay, I'll read the question here. Okay, she was just Barrister Shade was trying to confirm what we have just said. She said, I practice naturopathy myself, and I know well enough that we have natural plants in Nigeria that have antibacterial and antiviral properties. She said, we also have not had the opportunity of subjecting the hypothesis about the properties in this plant to rigorous scientific research. But this does not stop us from taking advantage of the knowledge we have about plants like ginger and garlic. That's Barrister Shade that has said that. And Edison says is that, okay, I think you've asked that question already. He says, do you have record of statistics of young people affected by this pandemic in your region? The virus is really spreading faster than we can imagine, and things are happening at a rate that is unprecedented. The belief has always been that it's only the old people that have been dying from this virus. And the notion has also been that it is old people that have other underlying health issues that have been dying from this. But this week alone, we have seen people who were, the actual number I don't have, but we have seen people who are 23 years old that were healthy and didn't have any underlying health conditions die from this virus here. We have seen 21-year-olds, we have seen 30-something-year-olds that have died from this virus. These people were healthy. So it's not like, oh, you said they were not exercising enough or they were not in good condition. No, we have also had a 13-year-old die from this virus here. The actual numbers I do not have, but it's on the news, the number of people, young people that have died from this as well. So it's something that we must take seriously. It is not, one of the things I wanted to say before my time ran out the previous time is that we have to get to a point where we must see this as a decision we must make and not wait for it to be enforced by the government, because it's something that can affect anyone and anywhere. You can't say, for instance, how your immune system can fight the virus. Everyone reacts differently to the effects of the virus, and this calls for more vigilance, this calls for more concern, and it calls for the need for everyone to stay as safe as they can. Yeah.
All right, thank you very much, Dr. Chioma. Apostle is online now. He said he's been following, so we're going to try and switch over to Dr. Martins and then take his presentation. Hello, sir. Unlock your video and audio. Unlock your video and audio. No, we can't hear you yet. You need to unlock your video and audio. He's trying to come up. No, you need to come as a presenter. You are coming up as a